The only thing that I absolutely love about it is my piss is neon blue. I love to give them that urine sample cup of that neon blue shit. They're looking at it like I'm some alien that resurrected from planet Mars, dude. Like, I swear to God. I'll stand at like one of those like urinals, you know, where all those guys line up in the urinals, and I'll stand back on purpose so they can see my piss is blue.
Welcome back to another Second Opinion episode with Dr. Jesse Haggard. I'm Dr. Jesse Haggard.
And I'm Virgil.
And today we're going to talk about pretty hot topic, methylene blue. So, Virgil, what do you know about methylene blue?
Well, I actually know quite a bit about methylene blue due to the fact that you got me on it. And I actually really, really love it, but I'm not going to say too much about it. The only thing that I absolutely love about it is my piss is neon blue. And people look at me like this is insane shit. Like, I'll go get drug tested, I'll go get STD tested, and I love to give them that urine sample cup of that neon blue shit. They're looking at it like I'm some alien that resurrected from planet Mars, dude. Like, I swear to God. But I also love it because I'll spell my name on the brick walls in my piss so everybody can see that my pee is blue. Or I'll stand at like one of those like urinals, you know, where all those guys line up in the urinals, and I'll stand back on purpose so they can see my piss is blue. I don't know. It's kind of a weird thing I like to do. Is that bad?
Well, what's really funny to me is how many people that I know take it, and it's more than any other medication I know, is everybody knows when they don't take it because they're like, man, my pee isn't blue anymore.
It first turns into like a green color.
Right.
It looks like you're pissing out algae or something weird, you know? But then it goes to yellow. But no, that's when you know that the methylene blue is out of your system, clearly. But I like to give those urine samples. It's like it tickles my heart.
How many urine samples do you give on a regular basis?
Well, you know, being in the gay community, I do get STD checked at least once every 3 months. So that's about normal.
All right. All right, so going back to this, methylene blue is kind of touted as the first synthesized drug in human history. So it's like developed and figured out or synthesized first in later 1800s, but it was a couple decades later where they started using it for medicine. But this is the same dye they used in textiles to make blue jeans and other blue materials. But it was used later they found it had all these kind of like antimicrobial properties. So then they were using it in malaria, and they found it to be pretty effective. And even to the point where in World War II, they were giving it for malaria prevention in soldiers. And how they did it, though, is they gave them dropperfuls of methylene blue, like a tincture. So they would take several drops, but because it's just drops in your mouth, it would stain your whole mouth blue.
Yeah.
So over the years, it kind of lost popularity. A lot of the soldiers were just tired of everything being blue. And then other malaria drugs were developed, and so there was other choices. However, about 7 to 10 years ago, there was a bunch of outbreaks of malaria. And so they started doing studies where they would compare the new malaria drugs versus methylene blue. And methylene blue seemed to outperform all the other medications. Also, there was a cost effectiveness to it, and it had less side effects than the other medications.
Now, are there side effects with methylene blue?
They're mostly discoloration side effects.
Yeah, I know that like if you take it long enough, your insides are dyed blue.
Yeah, and it even crosses the blood-brain barrier. So it's a super small molecule. And if you actually get raw methylene blue powder and you spill it, you absolutely don't want to go blow it off the counter.
Oh my God.
It turns everything blue. And not slightly blue, really blue.
Let me ask you a question. I also know in World War I, they also had a song about methylene blue. Do you know what that song is? Because I did a little research before we did this because I didn't know much about this stuff, even though I took it, but I had to do my research because I'm not putting anything in my body until I do a little research. But do you know what that song is called?
I didn't know it until you brought it up.
It's called We in the Lou, We Pee Blue. So they all were showing their blue piss to everyone.
So with this recent outbreak, though, when they did this comparative studies on these other medications, these were in modern settings. And so they were looking for side effects, monitoring for other things. And they found that the side effects were mostly beneficial with methylene blue, specifically for neurodegenerative conditions. So conditions that involve your nerve cells. So this is anywhere from Parkinson's, Alzheimer's, traumatic brain injury, and even multiple sclerosis, MS. And after that, then you see the anti-aging community looking at that data saying, wow, this can treat these chronic neurological conditions. Wonder if it could prevent them. Could it actually enhance your neurons, enhance your memory, enhance your cognitive function? And so that's all going underway. But just because also that the side effect profile of methylene blue is so low, there's not really a huge reason not to take it, except for the whole, you got to turn blue a little bit.
Yes. And I know you can't throw up.
Yeah.
I learned that lesson really quick.
Yeah, you don't want to do that.
And don't miss the toilet in your own personal bathroom because your toilet is white and you piss blue. Your toilet lid will be stained blue a lot. That's how we know a lot of people that are taking it, but at least we know they're healthy.
So some of the other observations they had were viruses were getting better. So they did specific studies on HIV, Ebola, and even coronavirus, and it was shown to effectively eradicate those 3 viruses.
So when you mean eradicate, do you mean like get rid of it or just
kill the virus?
Kill the virus. Interesting.
Yeah.
That's awesome.
So I mean, it has this really strong antimicrobial effect. That's why they even used it in aquariums over the years
to get rid of
infections.
Infections, yeah.
In the fish.
Yeah, the white parasites that are on them.
Yeah.
Yeah, that's
so
cool.
It has antibacterial, antifungal properties that we've seen in aquariums and aquatic life. So then in humans, they started studying it for all these other things too. So it definitely has antibacterial properties. That's probably the most studied antimicrobial effect besides the viruses, and it in humans, that is. And then in humans also, it has been studied for antifungal effects. However, it also enhances other antibacterial or antifungal agents. So it makes the other anti-whatever medicines more effective because it's hitting it at multiple mechanisms of action.
And I know I did a little research on it, but correct me if I'm wrong. I know if you do that red light thing, I forgot.
Red light seems to enhance the effects.
Of methylene blue.
So
and then
combining all this stuff.
I know it brings also oxygen up to your brain or something.
Like that. So it's also the antidote for cyanide poisoning, which actually changes your hemoglobin so that it doesn't carry oxygen as well. It's also been studied for carbon monoxide poisoning, but it is the actual antidote in like a hospital setting for cyanide poisoning.
That is so cool.
Yeah, so it definitely has that effect on your hemoglobin to have more oxygen carrying capacity.
And then I think let's see, what else would I... Gosh, I did it because I know my memory is gone, and I heard it brings back your memory loss, right? Or something like that.
Besides the fact that you say my urine's not blue, so I didn't take it. Didn't remember to take it.
Yes, exactly. Yes, and that's how. See, it's the proven fact right there. Proven studies.
So, just a little bit of safety precaution. Even though we said mostly doesn't have a lot of side effects besides the discoloration side effect. If somebody takes antidepressants like SSRIs or MAOAs, those kind of medications can have some contra effect or counter effects to methylene blue. So if anybody is taking an antidepressant, those categories, definitely would want to talk to a healthcare practitioner before you try to maybe do a trial of methylene blue and see if it's for you.
Now, is this an over-the-counter kind of prescription, or do you have to get it prescribed by people?
It can be over-the-counter. So on average...
Because I know you can, I don't mean to interrupt you. I'm so sorry. I do see a lot of people on TikTok selling it, but in the drop form.
Correct.
And then I also have seen celebrities taking it actually.
Yeah.
I believe RFK Jr.,
Yeah, it's
Mel
gotten
Gibson,
really popular again.
Joe Rogan. I know they were talking about it, but I've seen RFK Jr. actually in like some kind of a thing on TikTok where he was dripping in his water and drinking it down.
Yeah. So the problem with that though is taking the tincture, same thing with the World War II soldiers, it turns your whole mouth blue temporarily, except if you have fake teeth, some of the composite materials, irreversibly get stained.
Oh, then you'll know
So-
you have fake teeth.
So, especially, I mean, sometimes fake teeth aren't real cheap.
Yeah.
So, you know, might be cautious on that. However, I actually have some chairside veneers done in my teeth, and I've been taking the capsules now for months, and I haven't had any problems. Now, that being said, so the capsule, you could take it and kind of avoid staining your mouth blue, but I have had a few stories of people taking the capsules that vomited,
Yep.
and then now the whole idea of not staining your teeth is out the window.
I actually know a girl that threw up in her car, and it was white leather. Do you remember that? Weren't you with us that night?
Yeah, I was.
Yep. She got a little intoxicated, and she threw up blue, and her whole white leather was stained. Now, is there some way to get this stain off?
Yes, oxidants can help. Bleach can work in the toilet, but I've had some stains when we were making it and doing different things, and I mean, like really stained my countertop, and it was a bit porous, and so it was a hard time getting it off. And then after a little more research, I found vitamin C and hydrogen can actually oxidize and discolor it. In fact, if you get into elemental hydrogen or molecular hydrogen, and you're doing like hydrogen water or hydrogen treatments, even with breathing, you could take that hydrogen gas and bubble it through water and make hydrogen water. That's a lot of times you'll see like these canisters, pretty popular online right now. But you get these canisters that use electrolysis in order to make hydrogen, and then it bubbles it through the water, and you make hydrogen water. And in order to test the content of your hydrogen, methylene blue is the chemical used in order to check how much hydrogen you have in your sample. If you ever try that, though, one other caveat on that, it needs to be distilled water for the methylene blue to actually go clear. And it's like you do a reversal analysis. So each drop is equivalent in a certain sample size, usually it's 6 milliliters. So 6 milliliters of your sample of hydrogen water, you mix, you add the methylene blue, and as you add the methylene blue, it turns the sample blue at first, and then it goes clear. And then as you keep doing it, once you get to the point where it stays blue and it doesn't go clear, then you go backwards, and then you can calculate how many parts per million the sample had of hydrogen.
Interesting.
Yeah.
Now, can you overdose on this, on methylene blue?
I believe you can. I don't really see it too often because it's got to be a pretty big dose.
And I do also remember I did try an IV version of it.
Yeah. So the IV version is what they use for cyanide poisoning because you need a big dose. And if you look at the side effect profile, it comes from that data where they're doing this huge dose in a hospital, for cyanide poisoning, possibly carbon monoxide poisoning. But when you're doing it for more chronic disease or even anti-aging effects or just general health, you're using a way less of a dose, even if you do it IV. But the IV is pretty cool, right?
It was
like-
pretty cool.
like
but I was
this
so scared because I remember
bright
I took
blue.
yes, oh yeah, and you piss a lot of blue. But what I'm saying is I was so nervous because remember I took a 100 milligram pill and then I took the IV and I'm just like, oh my God, am I gonna die? Remember, I was tripping.
Yeah. So another thing is the purity, as we were talking about, like how to take it, whether you get the tincture or not, or you do capsules, or even IV. So you want to check the purity of wherever you're getting it, because when you synthesize methylene blue, it forms heavy metals. And the FDA only requires so many heavy metals to be checked, or certain microbe, possibly infection for the raw material. And so even though the FDA says, oh yeah, we need to check this, this, and this, there are other companies that go beyond that. And they'll actually monitor or change the way they synthesize the methylene blue in order to avoid those heavy metals being built up in your system while you take this thing to make you healthy, and then you don't want to be exposing yourself to all these heavy metals at the same time.
Yeah.
So that's where typically, depending on what company you get it from, you can request a certificate of analysis of the raw material they use to make the methylene blue, or even a third party or an analysis of the final products that you're using, whether it's a tincture, capsule, or even injection of the IV form.
If someone wanted to purchase this, where do they go?
If you buy this online, the drops are typically over the counter, but when you surpass a certain concentration, depending on where you're at, most commonly I've seen like so many milligrams per kilogram of body weight. It comes out to be about 35 milligrams on average, especially if you're doing capsules. Then it's usually considered a prescription drug at that point that you should be monitored while taking it.
Okay.
And then the protocols I've seen most commonly is you start out with a 25 milligram capsule if you're doing capsules. And the nice thing about the capsules is you can get way higher of a dose than the drops without completely staining your mouth.
Yeah. So capsules are the way to go if you don't want to stain your mouth.
Yeah.
Push comes to shove. But I know, like, I think RFK Jr., he dilutes it in water.
Yeah.
I think I saw that. But now, if they want to get the prescription version of it, do they see their doctor? What do they do?
Yeah, they would just talk to their healthcare provider about it. And the protocol I've seen mostly is you take one 25 milligram capsule, usually in the mornings, because it tends to give you a little energy. And that can interrupt people's sleep if you take it at night. So I always recommend to the doctors that are prescribing it, do 25 milligram capsules, one a day in the morning. Doesn't really matter with or without food. And then for the first week, and then after the second week, you do 50 milligram, so two 25 milligram capsules. And then the third week, you can either go to 75 or you can just jump to 100. 100 milligrams is really more where the effective dose comes in. It's just that, just to be precautious, that's the protocol I've seen mostly is you start with 25, then 50, just to make sure everyone's going to tolerate it okay and not have any side effects. But for the most part, I've never observed a side effect in somebody, and I've never observed anybody having issues with the antidepressants. So I know doctors who have prescribed this to patients with who are on antidepressants, and they just take the dose real slow, and then they watch for serotonin syndrome is what you're looking for.
Got it.
So, but besides that, the effective dose, once you build a or show that you're tolerant to it and you're not going to have problems, is generally between 100 milligrams and 300 milligrams a day. So I would say like an anti-aging, just trying to promote general health, energy, good mitochondria function, which mitochondria, that's where this is affecting. So the mitochondria are the powerhouses of the cells, and specifically the mitochondria in nerve cells is what seems to help the most. And interestingly, in microbiology, the methylene blue is also the stain used in order to visualize mitochondria on a slide using a microscope.
Interesting.
So it's interesting that that's the organelle that's affected, is the organelle inside the cells that are actually turning blue. So where it stains it.
That's awesome. Oh, that's good to know. Well, so far, everything I've heard is just plus, plus, plus on it. That's why I continue to take it. I haven't seen a dick grown out of my forehead yet or anything, so I guess we're good to go.
Yeah, but for the most part, I love methylene blue. I highly recommend people to experiment with it, try it, and especially just even having it as like a back pocket little remedy in case you do get some sort of infection that's not going away,
or even a
having
cold,
problems, or start developing a neurodegenerative issue.
Or if you're just an angry little bitch, take it. Like me. I'm just kidding.
And worst case scenario, you have blue pea, which is always just fun to try. I think in summary, we hit it. It's anti-malarial, antimicrobial, antiviral, and increases the powerhouses of your neuron cells, your mitochondria. So I think it's a pretty healthy thing to give a try for most people.
And remember, let's all pee blue together. Well, all right, we'll see you on our next episode. You guys have a blessed day, and we'll talk to you later.
Follow my podcast on drjessehaggard.com.